welcome again once more, and this is the voice. And in this short segment, or in this second segment, rather, we will be discussing healthcare and affordability here in the US and what does it cost, especially for those that do not have healthcare through their work, or those that are working sometime part time or working in small businesses that those employers do not offer uh, insurance per se. So I will have an agent here who is very versed in this field, Mr. Nkem Foka, to come in here and maybe dissect some of this thing and what we should be doing, especially we from Cameroon that will have most of our parents here that they do take care of our kid and they are not working and sometimes pay for medical bill. It may become a really, really serious problem. So this is where there are opportunity out there, but we really need this information. Let me bring Mr. King here and we'll discuss this. Uh, Give me a second. Let me take out this. Okay. Yes. Mr. King, good morning and welcome to Gaza Media for the first time.
Good morning. Thank you, Dr. Ernest.
Yes. We've been trying to do this for a long time, and I know I'm kind of busy schedule. I'm glad that we finally make it today. So please, the first thing I want you to do is introduce yourself to our audience, especially those from the BLM community. I know we met in Boston during the Lukudu USA convention, but just introduce yourself and what you have in mind before we dive into Pacific.
Yes, I'm actually in King Foka. I hail from the Gensa of late Chief Foka. As a capacity in the community, I'm actually the current vice president of Lukudo, Georgia, and also very active in Lecter, Georgia. So you would see me in those different capacities when it comes to the community effort here. And probably you'll be seeing me back home because I'll be out there for a project as well to, scan the community for projects we can fund from Georgia as our initiative for 2026. But in this conversation today, I would like to kind of set the expectations. I'm speaking today as a certified representative of the Center for Medicare and Medicaid, which manages health insurance programs in the United States. So how that happens is you basically can get certified by taking their certification programs, and then they will train you how to, sell different products that they offer through the different marketplaces, either through Obamacare, as you might know them, or through your state's health insurance marketplace. So at the capacity that I'm speaking today as a federally facilitated marketplace agent. So that's really what I'll be wearing as my hat today.
Yes, so Mr. Anton, yeah, that means you kind of work that you focus, you help. If I want to, lack of a better word, say minority community, the less privileged, so that they can know how to apply or how to get health insurance or how to get affordable health care through the kind of program that you are describing.
Correct. That's really where I'm supposed to, educate or at least provide that information for those who are not aware of these programs in existence. Because I understand it's a kind of complex system. The healthcare insurance marketplace is complex in America. Um, for those who get it through their job, it always kind of seems but natural that one time in a year your company says, "Oh, you have to pick up your insurance program for this period for next year," and that's really a done deal. But for people who, for example, migrated here through maybe their kids brought them here as parents to take care of the children, that is really a different story altogether because you don't have a job that will provide you that insurance, and you have not worked enough in the country that they would typically not give you most of those benefits that you would get even if you were not working. And then there are also those who, like you mentioned at the beginning here, who work for a part-time basis, and most companies would hardly give you a full insurance if you're part-time or a contract basis as well. So that kind of puts you in a bind because you don't have the means to get insurance. You have to go out there and shop for insurance, which brings us to how the federally facilitated marketplaces were created, or what you all know as Obamacare. That's how it came to be. which is how people who don't get insurance from their job will be able to also get insurance that they can afford through either the federally facilitated marketplace or Obamacare, or as most states have decided to take it their own way now, they also have their own state health marketplaces. So just to make sure you're not getting them confused, they are all the same thing. It's just managed through the state's own marketplace or through the federal facilitated marketplace. So
Yes.
I'll use those terms interchangeably in the conversation.
Yes, Mr. Ken, if say somebody is listening to us right now and sitting at home, say in Ohio, in Maryland, in Massachusetts, and they want to apply, or somebody sitting and say, "Hey, my mom is here. She doesn't have her insurance, but she have all the legal part, her social security, permanent resident, or sometimes some of them even have citizen." As we are saying that, probably we may not have worked here for a long time to have those kind of social security benefit. What is the process, step by step wise, to get enrolled?
Oh yes, I'm very glad you asked that question because it's really timely. There is a regulatory requirement that sets the time that you can enroll, right? So,
Hmm.
which explains why most people actually go without insurance because once that period is over, you can't get insurance until the next time. So, usually for people under the age of 65, you would be able to enroll for insurance during the year from November 1st through January 31st in the year. That's the only time you can pick up an insurance through these federally facilitated marketplaces or your state marketplace. And then for those who are over 65, that's Medicare, they can pick
Hmm.
it up between October 15th through December 7th. So those are the two different deadlines I would like us to highlight. So October 15th through December 7th for the seniors over 65, if you qualify for Medicare, of course, then you would be able to pick up a plan for the coming plan year. So for 2026, right now, this is the open enrollment period is running between October through December 7th for seniors, and for people who want to shop from the Obamacare marketplace is running from November 1st, which we're already in the open enrollment, through
Hmm.
January 31st. Just to keep in mind, if you do it between now and December 15th, your plan will start January 1st. Now, if you don't do it before December 15th, your plan will only start February 1st. So keep that in mind. It's another very tricky deadline there.
So the timing is very important.
Very crucial. If you miss that deadline, you can go a
Hmm.
whole year without insurance because the only other time that you might be able to pick it up is if you have a special enrollment reason. That means you maybe, for example, moved, right? Like they
Hmm.
consider that you may have moved from one state to the other or one address to the other, which provides you a chance to pick up a new plan in that area where you moved to. Or you might have had a baby, for example, and you need to include them in your insurance.
Hmm.
Or you might be living in an area where there was a disaster. America has plenty of them, hurricanes and all that stuff. So they open it up again for people to pick insurance. So those are the only times that you can get it during the year. It's called a special enrollment reason. Your income change, for example, could be a good one also. If you change your income drop or increase,
Hmm.
all that kind of stuff. Those are things that will give you the chance to do it anytime during the year, without which you can only do it during those periods that I just mentioned. So it's really critical to
Hmm.
remember those dates and keep tabs with those dates.
Yes, Mr. King, let's talk about the cost a little bit. So, the marketplace, sometimes when you are work, is automatically deducted from your paycheck.
Correct.
So now, what would be the obligation when you join the marketplace? You have to pay by yourself. You have to maybe make some form of arrangement, deduction from your bank account or stuff like that. But how much would it cost you if you go join the marketplace and shop? Do they do that based on how much you earn, or if you earn income at all and stuff like that?
Correct. Yes. I'm very glad you asked that question because this is really timely too. There has been a there has been a what they call a subsidization of the marketplace insurance,
Hmm.
which saw why the government was actually shut down was as a result of that subsidization, which some of it is going away. I just want people to remember it's not all of it that goes away. What is actually going away is the one that was initiated after the COVID pandemic.
Hmm.
So the government kind of subsidized most people's insurance, after the pandemic so people can get coverage. That new subsidization is what is actually going away. Your regular subsidization that existed before the pandemic will stay. I don't want people to get confused. That will still be there. So when you go into the marketplace, they would ask you if you would like to get subsidies or you want to be evaluated if you qualify for subsidies, which is income based. So
Mm-hmm.
if you're earning, just to put it in context here, if you're earning under 22,590, you would have fallen under the federal poverty guideline. So you would
Yeah.
typically qualify for what they call Medicaid. So you would get full subsidized because
Mm-hmm.
your income is pretty low for an individual.
Yeah.
And then if you are a family of four and your income is under 46,800, you would equally qualify for the full assistance as a federally poverty guideline basis.
Mm-hmm.
But otherwise, once you go on there, you would notice that the first thing they would do is they would evaluate your income. Based on your income, they would subsidize the cost for your insurance. So that subsidization will still exist. It's just not going to be full as big as it used to be.
B.
So you would notice a change in your costs in healthcare for 2026 because
Mm-hmm.
that part which was covered by the programs that were initiated after the pandemic would have gone away. So you would see that difference. So, for example, uh, something that would have cost you maybe like 800, they would have subsidized it to bring it down to like maybe $0.
Mm-hmm.
Now that might cost you around 400.
Okay.
Just to put it in perspective, right?
Yes, yes. Just it kind of saying that, oh, you will still pay a little bit
So you will
more.
still have to pay that $400
Okay.
that
Mm-hmm.
they were subsidizing for you fully last time by with the pandemic programs. But those programs are actually out of. They didn't, as far as it goes, they have not been renewed. So
Mm-hmm.
I would like everybody to go into this mindset knowing that those programs, until the Congress decides on those, expect things to be, like they used to be before the pandemic.
Yes, yes, yeah. Okay, let me go further and ask this. In terms of when you, I've never applied for this. I don't know exactly. I'm asking you now. The packages, or
Mhm.
we call it, yes, it's package like the
Correct.
coverage. The coverage. Say,
Mhm.
for example, we have like Medicare, or we have like insurance. We have Medicare Part
The
A and
marketplaces, right?
B.
Just
Yes,
they're all generally referred to as marketplaces, just so you know.
marketplace.
You can clearly
So
say
now,
health
we
insurance.
to be clear, maybe if I use part A, people will get confused with that.
Right.
Let me just do that, because I think one of the things that people almost think most is the part of the medicine, the drug, the pharmacy
Correct.
side. At the
Yeah. Yeah.
So when you buy this, does it cover pharmacy costs? That if you go to the pharmacy, you will only pay maybe a copay of $5, $10, and get your medication
Yes. Just to put it in, I'm very glad you asked that question because health insurance is a very, again, like I said, is a very
complex.
business in America, complex indeed. But I would like to break it down so that everyone going out there to shop understands what they're buying when you're buying. So
Mm-hmm.
when we talk about health insurance, right, we're
Yeah.
referring to a plan that you buy from maybe say the marketplace, which will be Obamacare, or ACA as it's also referred to, or your state's marketplace. For example, in Maryland, it's going to be called Health Connect.
Mm-hmm.
Different states carry them with different name. In Georgia, they call it Georgia Access. They're all the same thing, just the states
Okay.
have the programs. So
Mm-hmm.
what you buy there is health insurance. And what does that cover? That covers your doctor visits, typical medical stuff that you would go do in a hospital, doctor's
Mm-hmm.
offices, and all that good stuff. And of course, prescriptions is included in those coverages, right?
Yeah.
Here I'm referring to people who are under 65. Again, that's what I said. It's really
Mm-hmm.
complex. You have to always make those distinctions. Now, if you are over 65 and you have worked over 10 years in America and paid your Medicare, you would then qualify for the Medicare, which is also offered through a different program. So
Program.
that program also has its open enrollment and it's also including some prescription coverage as well. So to your question, yes, most of those programs would include a prescription coverage, but there are things that they don't cover. Just
Mm-hmm.
so you know, when you buy a health insurance, don't assume that you have everything covered.
Everything. Yeah. Sure.
Your dental. So if you go to take care of your teeth, it's not covered.
Ambition. Yeah.
Your eyes, if you go to take care of your eyes, it's not covered under the plan.
Hmm. But do they have an option where you can include that? Because I know that in some, from my job or in some job places,
Mhm.
you include the eye vision, you can include the eye, then you pay maybe
Yes.
$50 a little bit more on
Yes.
every on monthly basis and
The
stuff like
point
that.
why I brought it up is just to make that distinction. So your job does the good job of packaging that for you, right?
Hmm.
They say, okay, here's your medical. That's how they refer to it. That's your medical. Here's your dental. Here's your vision.
Yes. Uh-huh.
So that's how they structure it. So you have all of that looks like one package. But in a nutshell, for someone who goes out there to the marketplace to shop, you would have to buy those separately because they're not in the same plan. So you would have to buy
Hmm.
a dental
Okay.
plan and a vision plan. And these are critical things to buy if you really, don't want to
Yeah.
find yourself with a big bill at the end of the day when you go into the dentist office or when you go buy your prescription glasses. Those things really come down to, cut down your costs, which is what I think we're really trying to talk today about. So please make sure you take those plans into consideration when you're shopping for insurance, because a lot of times people forget about them and then find themselves with a tooth problem and they have to dig deep in their pockets to cover for things that they could have afforded for really chicken change. I mean, most of the plans will be like a couple of dollars, 20, maximum $20 should get you very good coverage for dental and vision combined. So you should be able to
Yeah.
get affordable stuff like that, take care of things that you might miss and then have to pay a big bill later on.
Mr. King, when I was we're doing a health fair campaign and stuff like that, there was some table in some rural community where the literacy rate is very low.
Mhm,
People that could not go to on the internet or could not. There were some people that were volunteering.
mhm,
I think there was medical student that they would take down data of people maybe to
mhm,
go process it. But now my question to you is, our parent that you know so well, unless you have a kid that will do it for you,
mhm.
how would they be able to go on the internet? How would they even be able to know where to go look for this information? Do they have local offices or you must do it online?
Uh, it's really a good question too. The way it's structured in the United States during these open enrollment windows I mentioned, majority of it happens online, or you would have people
Hmm.
call you. But that's really where my job comes into play. So my capacity as an agent is to
Facilitated.
help to guide people to make that choice. So for those who really have a difficulty with those things, just give me a call, or I'll put a lot of the information out there. I do put it a lot. If you check the all the communities that I'm part of on the social forum.
If you could text me quickly, I could put it online over here.
Yes, I'm just saying if you check on most
Oh,
of the
okay, on
social
the
media,
flyer.
you would find
Oh,
a
okay,
lot
yes,
of
on the flyer.
information there. Review your medical. That's really what I'm trying to do. A lot of times
Okay.
people see it as a marketing. Yes, full disclosure, if you do sign up and get insurance through my services, I do get compensated by the insurance companies because
Hmm.
that's really how I get paid, right? So you don't pay me personally, but my job is the federal government says, okay, yes, we've trained you. You should be able to understand these programs and explain it to like the people you're referring to who don't have an idea, right?
Hmm.
So I can sit down with them, have that conversation with them about what are their challenges, what do they really need, and then we will go now to that marketplace and find a plan that matches that need, so that they're ready.
I think, dear viewer, I think what Mr. King is saying here that if you are at home right now, I'm bombomwe, ndole na songo je,
Mhm.
na nzota gi, otong numba gi, bejibo nung phone, mba kwidago, mba nga nung computer gi, ntong telendo, aliza bada zogo be spelling, ma numba go, mba go me procedure no facilitate and bo. Mr. King, I think that is in the summary, that is what you are trying to say. If somebody call you,
Very true.
you will be
Correct.
able to on the phone and able to walk that person through. Say one
Yes.
grandma is at home that doesn't know how, or yeah, you can really help in that regard.
Correct. I'm going to put the number out there. You have it already. You can drop it if you want. My
Yeah.
WhatsApp number is the same number that I use
Hmm.
for business. So I'm totally fine with you just dropping in and saying, text me something or call me. I'm totally open. Don't feel like you have to pay me anything. It's totally free from your
No,
side.
I think,
From the
yeah, I think I
from the
will be
person
able
that I'm
to.
helping, I want people to realize that because I know sometimes people think, oh, he's gonna ask me to pay. No, and then they'll be asking me, how do you get paid? So I always try to explain that to them. That no, it's
So,
not you
but
that's
they'll
going to
know
get
that they'll
paid.
say
So
nothing is for free.
feel
Yeah.
free to call me because the way the system is structured, again, one of those complexities we were referring to, the way it's structured is the insurance companies don't have the people to go out there and inform people. All they can do is put it on online, but not everyone has that capacity to go online and read.
Oh, okay.
So my job is to tell people what that insurance programs look like, what that does. Like if you go in there, you will start to hear about deductibles, co-insurance, all those things. What do they mean? That's the thing that I'll explain to you. So you
Hmm.
kind of understand what you're signing up for. Because most of the time you buy a program, it would say, oh, you would have to pay this monthly payment. And then most people think, oh, okay, that's all I have to pay, which is not true. When you pay that monthly payment, you go and see your doctor still has to charge you what they call a copay. A copay simply means you're
Yes.
sharing the cost with them.
Uh-huh.
So those are things you need to be aware of. So it doesn't mean once you've paid one time, you cannot pay anymore. You have to keep making your contributions as you get to use the services. So
Yes,
those
and
are a few
yes,
things that
because I think because that is also very true, especially when people buy the just know, oh, because they used to be like when you started explaining in the earlier, you started saying they used to know that Obamacare is free. They used to say Obamacare, but now you started that say, oh, those subsidies and all of that, so that I think a one-on-one will really kind of help people able to really get one-on-one, and so that anybody have any doubt, you may explain to them. I know that sometimes if you have like some kind of chronic illnesses,
Mhm,
that you have some kind of maintenance medication
mhm.
that you regularly take them, maybe when you are choosing a plan and other kind of stuff. I think those are some of the things that you may be able to explain.
Correct. Which brings me back to the topic I had actually mentioned earlier. If you qualify for Medicaid, Medicaid is another federal program that assists people with low income, right? So if your income is under 22,590, you should qualify for this full assistance from the federal government program to subsidize your care so you don't have to pay because you don't
Hmm.
have the income, right? So that is where that comes into play. It helps you pay for all the things that you would normally not be able to afford. So it's really critical that you provide that full disclosure that, okay, here is my income. They will use your income to evaluate you on how much you would be able to afford. Now, once you meet the federal poverty guideline as an individual or as a family, so for individuals 22,590, if your income is below that, you should qualify for that. And then if you are a family of four, that's 48,600. That is where you would also qualify. So that will help you make sure you don't have to pay when you go use services. Just to keep in mind, there are some changes that will be coming in that program as well in 2026 after the new big beautiful bill that will change that requirement for you to also go and look for a job if you can to continue to be on the program. So some changes are also coming in that direction, which I would like everyone who is qualified for that to be aware of. They might have you go out there, just go and say, "Oh, I'm looking for a job,"
Beautiful bill.
and then they would say, "No, you cannot give you the job." You bring that information back to the program and tell them, "Oh, yes, I went out to look for a job and I couldn't get a job," and then they will now reevaluate you again as qualified for the program. So those are the changes that I want people to be very, very conscious about. Is they will send you those letters, right? And if you
Mhm.
don't react to them, they will just cut you off. So don't be the person who did lose what you could actually qualify for because you did not take
Okay.
action, right? So those things, be very conscious of those because the laws are changing really quick based on those new laws. Everything they ask you, make sure you provide it well in time because if you don't, they will cut you out and then start evaluating you until they have all the documents they need. You will not be covered. So keep that in mind. I would hate to have you be this person who could have just provided them. They ask you for a document, you didn't send it to them, they cut you off. Now, until you provide them that document, they will not reinstate your coverage. So please
Mhm.
be very aware of those things. There will be a lot of that happening from now on in
Oh,
2026 because they say they're trying to use the laws to kind of cut out the waste. So the
yeah.
waste that they're saying is people who they thought might have given them false information about their income. They want to reevaluate that income, so they would ask you to prove your income. Income proof here would be maybe your tax documents for the previous year, or that this is how much I earn right now, and they'll ask your employer and what your pay is. So
Hmm.
please make sure you provide them with the correct information. And if that information changes, never mind, always update that on the records. Because if you don't, and then you go file taxes, say for 2027, what they will do then is they will reevaluate based on what they assisted you in
Yeah.
2026. The extra, they would have you pay it back.
And that
So
is not something that you
nobody
want
likes to pay back
to
money
pay back.
that
Yeah.
you had earned and spent. So it's never a good thing. Always try to keep that information updated. That's really all what I want people to take away from this conversation. When they ask for anything, update them quick and provide them early enough. Say, for example, this year, if you applied and they evaluated you as qualifying for this, but they need you to provide this, please send those documents well ahead before January 1st. So your benefits kick in immediately in the first from the 1st of January. If you don't, they won't give you coverage until they have those documents. So I would like people to really, and previously it was not like that. Usually they would cover you until they can prove otherwise, they would disenroll you. But the system right now is saying no, we will not cover you until you prove that you qualify for it. Make sense?
Yeah. That's a
That
lot.
that's a big difference that is going to
Different.
come. So
Come.
a lot of things will be based on what you prove rather than what you think you said you had. They will not wait for you to bring that. They would
No,
rather have you come and provide that proof before they give it to you. So
to you.
that's really where the changes I would see. A
Yeah,
lot of
I think, yeah. I know, I think our viewers are listening to this kind of information, especially those that, I mean, if you're never in a situation where somebody is sick or you have an elderly person who might have some kind of diabetes or some chronic cough that they have to be on some asthmatic medication and stuff like that, you will not really know what this really means, or somebody has to go do regular checkup that
right.
every month, and then they have to go see their doctor. So
Mhm.
people will not really understand the gravity and the severity and the seriousness that is attributed. I know young people, very active, agile in our community, they don't bother about this. But
Right. Right.
if you already above 50, 60, have elder people at home, this should be something that you should really need to take it serious. And I thank you so
Correct.
much. Yes.
Correct.
Then now
Yeah.
coming to, yes, go
I
ahead.
just wanted to add there because you mentioned it. The seniors do have the Medicare program, and there are a lot of
Hmm.
help for them as well. So if you do find yourself with a chronic condition, there are special programs designed for those conditions. So if
Hmm.
you have a situation like that, please don't hesitate to reach out. I'll be more than happy to explore with you all those options, federal programs that will provide you extra help to cover for your prescriptions and all that stuff. This again, things that if you don't apply for, they won't just come and give it to you. Makes
Yeah.
sense. But if you
Yeah.
qualify for them based off your income because you were, falling below that poverty guideline, most of those things will be offered to you naturally, automatically. Well,
Hmm.
if you don't and you really are struggling, then you can still apply and get them. That's why I just wanted to add to that. Based because
Dear viewer, I've just added the contact number on the screen. You can see here the number just below, or his name here is right there, so that at any one point it will be there. You can call him, and yeah, it's still the contact
so
that is on the
I
phone.
am totally open. If I don't take your call, I might just be busy, but I always call people back.
Okay.
I don't miss any calls. So if I miss the call,
Yeah,
I always
and as well, if you call, leave a short message so that they
I will
know the
drop
reason.
also, I'll send you the link for people to set up appointments. That's even more
Mhm.
effective, right? That way they don't have to call me
Okay.
again.
Yeah. All right. Good.
Yeah, I'll drop that link as well. That way we could,
Yeah. I mean, I can even put it on our WhatsApp forum that a lot of people visit and stuff like that too as
yes,
well.
yes. I would,
Yeah.
if you want, we could drop that there.
Mhm.
That will be easy, much more effective because you just fill out the form. It's really basic questions, yourself, your
Yeah.
information. So when we
Hmm.
pick up the conversation, we already have all that information and I can assist
Yes.
fastly.
Hmm. Yeah, so that when they pick up, you can easily just pull up the information from there and just move on. I think
Yes.
it's a wonderful program.
That's the link. I think if you look on the forums where you see most of the ads I put out there, that's really what I put on there, just so I can get
Hmm.
the people who really need help to sign up. But again, most people who are not tech savvy, please call me the traditional way. Ring that telephone number, I'll pick it up, or at least I'll call you back once I see that, or text me. There any which way that you prefer to communicate, I'm totally open with all the communication means that are available out there.
Hmm.
Um, and then if there's any last thing I want to add here is the savings part of things, like how to
Yes.
to strategize and cover those things that insurance would always cost you more going into the future. So I want people to be aware of what they can do and really use tax-free money. and take care of themselves. Something that I know our people are not very, very versed of, but it's there. It's always been there. We just don't use them. This applies to everyone across the board, whether you get insurance from your job, whether you're getting it from the marketplace privately, all of this would apply to you as well. It's called the health savings accounts.
Hmm.
This is kind of like a federal program that says you can put money aside for health insurance purpose. That's tax free. That money is not taxed. So
Oh.
yes, for an individual it's 4,200, and for a family seven eight actually 8,750 this year that you can put aside. It's always going to be there for you. The
Hmm.
money rolls over year, but that you can use to pay for insurance, health insurance costs. All that money is tax deductible. So please stop leaving that money on the
So,
table.
if you stock money on that account, that money can be when you have medical costs, you can
Yes,
deduct from there
make
and
sure you
pay.
pay all your bills with that money. Just don't use your regular check money on your pocket to pay anything, because what you're doing basically is you're paying tax, take money that you've paid tax on to pay. But if you have an account like that, it's simply saying I'm using tax-free money, right? I'm paying for my
Hmm.
health. So all that money you can deduct up to 8,750 for people who have family. That's a big deduction from your tax bill. So please don't leave those monies on the table. As a matter of fact, if you add all the different accounts that exist under this program, in a year it would add up to 32,800. So you have the health savings accounts, you have the flexible savings accounts, you have the dependent care flexible saving accounts, and then you also have the IRAs, independent retirement
Hmm.
accounts. If you add all of that, those are all tax-free accounts. That when you put money towards those accounts, in a year you can add up to 32,800 that you will write off.
So wait, Mr. Focus. So you are saying that, say for example, if you open in of this account and say for your medical insurance, so are you saying that what the money can be deducted from there to pay your insurance, your premium, and the
Oh
rest?
yes, oh yes.
Oh, so
All
you open an account and
correct.
just
Put the
and block
money
some money.
Put
Okay.
all the money you put in there is tax-free money. It's never taxed till you die.
So the money goes there before it come out to pay your medical bill or
Exactly.
whatever it. Okay.
Exactly. So
Okay.
always make sure you have that account. And it's the idea there is you would always
So
be
so you pay bills from medical bills for, or whatever
everything.
from
Yeah.
the account.
The account set up just like your bank. When you go create an account with a bank, right? They will send you
Uh-huh, uh-huh.
a debit card. It's
Yeah.
the same thing. You would get a debit card when you go for all your medical stuff. Give them that debit card. They will deduct from there. If you go to the shop, like CVS, Walgreens, all those shops,
Mm-hmm.
all the things that are legible would
Medical,
also
yeah, medical bill, yeah.
you will pay with that card. Yes. As a matter of fact, there are so many things you can actually pay even for hotels. If you're traveling for health reasons, you can pay the hotel bills with that card as well. Oh yes. So please don't be wasting your money that you've paid tax on to pay for your medical bills. Don't do that to yourself. But there are some caveats I need to add here. Those programs would qualify only for high deductible plans, right? Which
Mm-hmm,
they've
mm-hmm.
made really accessible for most people. So for 2026, usually what they call the bronze plans were not qualified for just being a bronze plan was not qualified for health savings accounts, but that will be the case from 2026. If you sign up for a bronze medical plan, it's also going to be qualifying for health savings accounts. Previously, it was just high deductible plans, right? Because they
Mm-hmm.
know your deductible is too high, then they created that health savings account to supplement you paying that high deductible. Now they've made it such that, you know, when you pick up that plan, any bronze plan will qualify to contribute towards a health savings account. So that's what you will realize when you go and create one. Now, for the question that you probably follow up is how do you create such an account?
Uh-huh.
Typically, you can go through your bank or through most of the people who do it through their job. They would all tell you that to do it through your health your health provider
Yeah.
administrator from your job.
Mm-hmm.
They also run the health savings accounts. So please do well to talk about it with them. Don't leave that money on the table. It's like you're leaving that much money on the table each year that you could be using and saving. So when that time really comes, you don't have to worry about paying the bill. Keep in mind, it
Hmm.
doesn't, you don't have to use pay contribute the full amount, because a lot of times people say, but I don't have the money. Of course you do have the money to pay your bills, don't you? So why do you say
Sure.
you don't have the money? When you get sick, when you go to the doctor's office, when you go buy prescriptions, you pay for them. So
Yeah.
that money you should be put into that account and not put it in your regular bank account, because they're taxing that money. But if you put it in that account, they can't tax it. Make sense? So
Yeah.
you're saving a lot of money by not putting it in your paid out of your regular bank account, because that money
I
you're
think
paying for is tax
I
money.
think yes, sure. I think
So
we
those are
have
really technical strategies people should be
yeah,
taking advantage of, because the money, as long as you leave, you would have that access to that account to use it for whatever medical approved reasons, right?
yes.
That's really what I want people to take away out of the conversation. And it's
No.
mostly high deductible plans, which can sound scary, but in terms of affordability, most people anyway end up with a high deductible plan, because if you buy all those gold, platinum, you must be really, your pocket must be big to afford
Big.
them anyway. So, but if you have a high deductible plan, most people afford the high deductible plans because they're usually the most affordable plans.
Yeah.
So that's why it's always good to align them with a health savings account.
Yeah.
So yes,
So
and of course you
I
can reach
think
out if you need
I
help with
think we
that.
will need to I think we need to maybe program so that we break this knowledge step
Right,
by step. I
I
get it.
know we
Yeah,
can't
on the
cover
medical fee,
everything.
but a lot of people it
Again,
becoming complex. Yeah.
those are the
Anyway.
conversations I have with people when I help them. Because a lot
Hmm.
of times people think we're just going to call you and be talking insurance jargon. No, I don't do that. I wouldn't be talking to you things I know you don't understand. I
Yeah.
will be talking about deductibles, co-insurance, things that they don't
Information
understand. I will break
that
it
doesn't
down
make
to you to the basic level. Say this is your share, that is the government share, that's the insurance share. I'll break it down for you to understand, and I'll tell you the
hmm
things that you need to be aware of going into any plan that you're signing up for. How to make your, like I said, the whole idea is saving you money, how to be cost effective, how to plan for retirement. Again, the HSA there is that strategy of retirement, right? Because think of
hmm
it, if you start a health insurance saving account when you were in your younger ages and you keep putting money in there, that's money that can take care of you when you're retiring, right? Tax free money. That money
Yeah.
will never be taxed. Remember, never. It will never be taxed.
Yeah. Okay.
Yeah.
That is.
So that's another strategy that a lot of times people don't think of. They just say, I don't think I have money for that. Of course you do. Because at the end of the day, you would still pay your bills if you go to the
Hmm.
doctor.
Yeah.
I wouldn't do it for free. If you go to buy your medications, you wouldn't do
You
it for
still have to
free.
pay.
You
Yeah.
still pay. So why would you be doing it the wrong way when you can actually do it the cheaper way? Just a no brainer for me. That's how I look at it.
Yeah.
Mhm.
Uh, so yes. Before we go, do you run? I think you had a private business.
Yes, I do run a health insurance agency, and I'm really, really looking for folks from my community
Hmm.
to assist in this business. The business here is how to help people do what I do. As you can tell, I can only do so much as an individual, right? So for anyone who is interested in learning how to become an agent and all that good stuff, please don't hesitate to reach out. I'll walk you through the process. I'll hold your hand, make sure you get certified. It's really not a difficult thing. It's just putting your heads down and learning how the thing works, because that's really all what they want you to be able to do, right? And for those who don't really want to go that far, I still need assistance, because, like the communities that you're talking about, if we want to reach out, they're trying to create programs where we reach out to the underserved communities
Hmm.
through what they call assistants, people who can assist people, right? Like the seniors that
Yeah.
you're talking about. I can only be in Georgia or these other places at the time, right? But if I have more people in the different communities that we can,
Also, if anybody is across the state, different state, they
yes,
can.
we can
Okay.
have them being approved as certified uh,
Hmm.
assistant workers. They call them certified assistant workers to help people go through this enrollment process. So I'm looking
Hmm.
for people who are willing to do that across the Maryland area, the Ohio area, where we have a huge settlement of our people.
Yes, of our
I
people.
need anyone who think they can sit down with those senior folks, break it down for them in the most easiest and simplest way for them to understand. Please reach out as well. I would like to get you involved and get you help the community and get rewarded for doing a wonderful job. So please, it's really not just about the reward of what I'm
Hmm.
considering anymore, but rather about how we can help our people. Make sure everyone who go out there and spend that money on a health insurance when they could actually get it because of lack of knowledge. We should not let that be our story, right?
Yeah,
We should
that's
be
true.
able to get everyone who needs help the help that they deserve. So please don't feel like this is going to be a burden to you. You're not going to pay anything. From my side point, from the
Hmm.
standpoint between you and I, as a business, we don't have any interaction, financial transactions. So whatever you would pay would only be when you buy your insurance at the
Hmm.
end of the day. So you're not paying that money to me directly, you're paying it to the insurance company. And the way the structure works, the insurance company is now structured to pay us as the agents who have been trained, federally
Hmm.
regulated trained agents, to sell this insurance to the people who need them. So
Yeah.
don't feel like you're
So
gonna
once somebody subscribe and pay
you and I, in terms of I
insurance.
and the population, we have no
Yeah.
business financially.
Honest.
They're not going to be charged anything, except otherwise, of course, if you need to pay for your insurance. But for
Hmm.
me, you're not paying me directly, so we don't have any obligation for you to pay me for the services I offer. I'm not allowed to charge you for those services. So please feel free to reach out. It won't cost you anything from my standpoint. I'm not going to charge you for my services because I'm not allowed to charge you.
Yes.
And
Okay.
I have a fiduciary duty to guide you and make sure you get the best that works for you. Because the insurance companies actually compensate me for doing that job for them. So don't
Hmm.
feel like you're being uh, overburdened here.
Everybody.
Plus, I also come in the capacity as a broker, which is a very big difference, right? And in the insurance lingo or world, you have someone who's an agent for a particular insurance company. They're called a captive agent. I'm
Hmm.
a broker, so I'm not tied to any particular insurance company. So I don't have any obligation to a particular insurance company. If I take a look
Company.
at all the different insurance that are available in the market, I have a right to sell any of them that is available in your area. So that way, we
Mm.
really shop for the things that work best for you, and not because I'm
For you
pushing.
for okay for the patient or for the client.
Yeah, that's how transparent I am. I don't sell because I want to sell a particular insurance program. No, I sell because I know it is what meets your needs. And that's really important for me because we really want to make sure that what we're getting you is what will work for the best for your family and for yourself, right? And not just for my interest on what the insurance company is paying me. Because if I look at it from that angle, I'll be doing not good for my fiduciary duties. That's what I'm
Yeah.
trying to do, to find the plan that works best for you and not for me, right? What your budget can afford is what I need you to be on and
Hmm.
what will work best for you. So yeah, please. I do run that insurance business. We do health life insurance as well, which is another topic for another day. I would
Yeah.
be happy to
Okay.
come back here and have that conversation. It's a whole different business line that I would encourage everyone. If you don't have it, please, we need to have that conversation. You need to make sure you have some level of insurance when you're not longer here with us. Someone your people you leave behind don't have to be burdened to bring you back home wherever you want to be put to rest. That's what life insurance does. It makes that process so easy.
Okay.
And
So
it's a
then I think with that one, I think we can schedule another time somehow
yes,
and
we
talk.
would have all of that bundled with the savings programs that I mentioned,
Yeah.
individual retirement accounts, retirement planning, health, life insurance, annuity. All of that is bundled under the package of what I also do. But my concentration is in the health space. Even
Yeah.
though I'm allowed to sell those other things, you would notice I don't push them that hard because there's enough people playing in that field. And I think we need to also have people who do the things that people really need, which is health
Need.
insurance. So I've kind of really put my specialization in the health field because I know the need is there and it's not
Yeah.
served.
Especially in the minority communities.
Right. It's not served enough. So I want to make sure we can get more people. For those who like to be licensed, I can help you through that process and get that business for you going as well. For those who just want to be care assistant workers, we can help you get that training and get certified. Right now, as far as I know, Maryland is seriously hiring for that. They're looking for people, and I've put in a request that I'll be happy to train more people. They ask me how many people can I provide. I just couldn't give them a fixed number yet, but anyone who really wants to do that, please
Hmm.
reach, because really all what it does is they show you what to do, right? when you go
Mm-hmm.
and meet the person, what to take care of, how you do it with them, and they will train you and get you rewarded for doing that job. So they can reach out to all that people who they can understand their system because they understand it. They themselves don't even understand their systems. Talk level
Same.
some grandma or grandpa who came in here.
Yeah. Then with a lot of technology, with a lot of computer navigating from one lane to
And
another.
then the last part, which I was almost missing out, is the people who came in here with immigration status. Just rest assured you will be covered. Just make sure all the things they ask you provided as fast as you can, especially those on the TPS or temporary protected status.
Mm-hmm.
Please, please don't let this be your story that they ask for something and you did not provide it and they cut you out because that's what they will do. I bet you. So if you are on a temporary protected status and you apply for insurance, you qualify for insurance, by the way, just so you know. For all of those who are in the immigration status under that category qualify for health insurance. I think the only one that they stopped was the DACA, which mostly applied to the Hispanics who were brought here when they were children. And that was stopped in August of 2025. So they no longer qualify for health insurance. But for us, who I know most people came in under the TPA, temporary protected status programs, they all qualify for health insurance. So please don't feel like, I don't know, do I get insurance? Yes, you do qualify. Feel free to go in and check and reach out. We'll help you. If you can't do it by yourself, we'll be able to assist you do that. And that also would require you to provide proof that you have that status or your income and
Mm-hmm.
that kind of stuff. So do well to provide that information once you apply. And that way your programs, your assistants kick in immediately. If you don't, they will just kick you out and have you prove it. Until then, you will not be covered. So please, I would like to also just, I almost missed that, but it's another very important
No, that's fine. Yeah.
topic to
No,
talk.
at least I think it has been some good information. So I think key takeaway message, please reach out if you are any person that you have that you are working, maybe part-time job, your income is now you don't have health insurance from your work, or you have
Mhm.
been struggling to get to the marketplace, call this number, find out and do it. If you have any grandma at home or some people that what the category that he's describing, income level, you know your income level, please take advantage of this program. It's very time sensitive. Very
Correct.
soon, we have about 1 month now. So make sure that you get in there and take care of stuff before you get to the point where somebody will run to emergency or will call an ambulance. Then you are not, you start
You
panicking.
can't afford it, right?
Yeah, you can afford it. Yeah,
That's the number one cause of bankruptcy in the United States: medical bills.
yeah.
Just so you don't know. So for those who don't know, that's how bad it is. So you can go into one operation to get into a hospital, get out, and you're bankrupt for life just because of that bill.
Mm.
So that's really how serious it is that you make sure you get insurance. Don't don't wait until you need it to get it because you will not be able to get it anyway.
Mhm.
The season to enroll would have been already over.
Well,
So it's really important to track those deadlines, which I'll repeat again. For people who are under 65, your enrollment window runs from November 1st to December 15th, rather, for plans to start on the 1st of January, right? So November 1st is through December 15th. Your plan will go effective January 1st.
mhm.
If you do it anytime after December 15th, your plan goes effective February 1st. Make sense?
Yeah. So
Critical
from
deadline.
next week, as November kick in, no, we're already in November.
Correct. So we are in the open enrollment period. That's why I'm
Yeah.
mentioning it.
Yes. Open
Started from
enrollment
the 1st of November. So if you apply between now and December 15th,
thing. Yeah.
your plan will be effective January 1st.
So people have 3 weeks now to jump
Yes. To
on and do
jump
it.
in,
Yeah.
if you can't do it right now and you miss it for some reason, then you would have from December 15th through January 31st for the plan to start
No.
February 1st. And that is it. Then the window shuts out.
Wow.
Make
No.
sense?
And
So
yeah.
you probably
But
can go.
I want to urge the audience that do it now. Don't even wait for
Mhm.
this.
And
Yeah.
now
Do it.
there are two. So the second one is for the seniors, people who are
Okay.
over 65 or who
Mm-hmm.
qualify for Medicare
Yeah.
through what they call a certain health conditions or
Sure.
disability.
Mm-hmm. Yeah.
They have a different open enrollment. Their enrollment starts on the 15th of October and then it runs through December 7th for their
So
coverage to
yeah,
start.
yeah, has already started.
Correct. all of them are already running. I'm just
Yeah,
saying
running.
those deadlines are very important.
Exactly.
Yes, very important deadlines, because if you miss those deadlines, that means you can go a whole year without insurance, except you have a special enrollment reason. So I'm just gonna drop that appointment link as well. Please share that with the audience. The audience.
Hmm.
We'll be more than happy to help. I'm just sent it to you. So that also will be the perfect place for someone to go on there and just fill out basic, it's really basic information, your name, your email and phone number. Those are the two things I typically will be able to communicate with you. And usually I have a time frame on the bottom of it. Feel free to be relaxed. Just pick any time that works best for you. If you can't find one, no problem. We'll always make sure we find time. But the deadlines are really, 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 really time sensitive. So don't miss.
And please don't even wait until the last 2 days because the network will be very congested. I know how this
Right.
thing.
It's not just the congestion, but rather the requirements, right?
Man,
Remember, like I mentioned, if you qualify and then they require you to provide certain documents. Come to
then you
think of
don't
it,
have enough time to provide them.
if you did it in the last minute, until you provide that document, you would technically be on a conditional coverage, which means your plan is not even effective yet. So you don't want to be that person
That,
who's just because you didn't do it in time. So yes, it's really a matter of time, and I usually
right.
try to do that ahead rather than wait till that last minute and tell people, "Oh yes, this is the last day." No, I'd rather tell you well ahead so you know what to do before you start saying, "Oh, had I known." 'Cause I met a lot of people throughout the year who would say, "Can I get insurance now?" I'm like, "Yes, but no." They're like, "What do you mean by yes and no?" I'm saying, "Yes, if you have a special enrollment reason, right? Did you have a baby? Did you move? Did you? There's so many
It is.
to come into play," and they'll be like, "I don't think I have any of that right now." I'm like, "Unfortunately, if you don't, I can't help you because the rule
Okay.
says you have to have one of those things for them to approve you. But otherwise, this is the time where you don't have to have any reason. So this is the period that you do it because you're qualified to do it during this time. After which you can't do it again except for a special enrollment reason. So please don't let this be a story that you missed out on a window that you could actually get insurance and you did not get it just because you did not take action. So
Okay.
mhm.
So, fuck, one of the time is almost running out. I want us
Yes.
to end here.
Okay, I
So,
really appreciate the conversation. I think we can have more of this on the social media platforms. I really would like to answer any
no, I think what we'll do is I will try to see how much we can be available so that we'll do it in short segment so
yes.
that it will not be very lengthy, so that we'll really deep into like
Pick a
packaging, like
topic.
topic,
Pick a
like topic.
topic.
Yeah, topic that will really hit our people. Like if you are
Yeah,
buying
and
this,
I'm,
how
I'm
much?
thinking beyond. I'm thinking beyond the United States. I'm thinking back home, how
Hmm.
we can equally start implementing insurance programs like that for our people back out there, especially after the crisis we've been through.
Yeah.
How we can implement social programs that will really take care of them. It's really easy to fund them because, come to think
No,
of
and
it,
I know for sure. CEO Emeritus of the Kudu USA, Atom Terence, had a program like that to the Open Mental Health of Africa,
mhm,
where I think it was partially funded by the Kudu USA and
mhm,
some other international organization like Library International Organization, where they had some the blocks of money
mhm,
because I was reporting at that time. So people will go to Medical Health of Africa Hospital for them. They will receive care,
mhm,
so they will not pay for services.
mhm,
The program will pay even for their medical or for their medicine up to about 1,200 pounds CFA.
mhm,
If you deliver, I think it was around 10 or 12,000.
mhm.
So delivery will be free. So that program was paying for that. That is kind of a similar program.
Nice. Now, what I'm actually referring to, right, there are actually insurance programs per se that we can actually
Hmm.
implement there. We just need to get a pool of people, right?
Yeah, yeah, just maybe take a step
Who
further.
contribute X, Y. Let's say they contribute 1,000 francs. We
Hmm.
value that money and go and shop for them as a group of people. That's really
Hmm.
all what your job does here in the United States. Remember, right? What your job does is they take advantage of you people as a group.
Hmm.
They use all your bargaining power as a group. They go to the insurance company and say, okay, we want to buy insurance for 100 or 200 or 5,000 or 5 million people.
So
You see how your bargaining power comes to play here?
the
So if I'm going
numbers.
to buy insurance for 5 million people versus buy insurance for myself, I have a stronger bargaining power, right?
Mm-hmm.
Same strategy I would like us to implement back home. It's really
Okay.
easy to afford to do. Have the community, like in all the other programs we've run where people contribute, they will
Mm-hmm.
contribute to get the money back through their health services.
Mm-hmm.
What the program really does is it takes that money, goes into insurance company and say, okay, we want to buy insurance for this group of people to make sure that if they go to the hospital, they can be taken care of for their, regular checkups. The insurance will say, okay, how much would that cost? How much do you guys have? We negotiate the price. Everybody who signs up to that program gets that coverage. So that is the same strategy I would like us to start implementing back home and make sure
Yeah.
everyone can go to the doctor without having to worry about being able to pay for it. Because it's
Uh-huh.
really affordable. It's just how we approach it, how we implement it. Those are the things I think we can copy from here pretty easily back home. Because all the insurance
Yeah.
companies you see here, they all have businesses out there. We just don't use them. We only think of
Mm-hmm.
it like, oh, until you need something, then you go and no. We can equally have them do it. That's how they work. Insurance companies really look for packages. They need someone to bring them that opportunity and then they will grab it.
Yeah.
You've made the effort to put all that people together, they see the value rather than go out there and do it themselves to get
Yeah.
everyone come and pay for it. But if we do it as a community, we go to the insurance company and negotiate, we get a good deal. They will offer it happily because not everybody will go to the doctor in a year, right?
Yeah.
But at least you would be guaranteed that those who go will be taken care of without
Take
having
care of.
to pay
Yeah.
because they will be paid for as a group. Everybody, same
Yeah.
thing
You
here.
say less. Uh-huh.
Your job does the same thing. The only difference here is they kind of put in it look like, oh, they are paying for it. They're not. You're literally paying it for it because they're taking it from your paycheck. So,
Mm-hmm. Yeah.
so all those who get sick get covered from everyone else's paycheck. And if you get sick, you also get covered from this, the whole
So,
pool,
and
the
some people,
pool of
many people don't even. A lot of people that are in the workforce, they don't even get sick. Go to this.
I know. So that's
Yeah.
how it works. It operates the same way across the board. It's like a pool of resources. So I would like
Mm-hmm.
us to really copy that as a strategy back home and really get our communities covered because it's pretty easy to do. Just like you would any other program out there that people contribute for
So,
whatever.
Mr. King, I think that's something that I think that would be a good statement for us to come and sit here, maybe break it
No,
down.
I like to approach it from a community standpoint.
Yes, I mean,
So
like prepare it or prepare a package. Maybe some of this convention, like in the
right,
summer where they
right.
have different community, you have the bang, you have the put them
All the
open, you have
local neighborhoods,
yes,
every
mhm,
different group. How
organization.
many people do you think you can say, okay, if we put this X amount of monthly payment for maybe 1,000 francs, how much can they afford? We look at it from that standpoint and make sure, okay, if they can afford this much, we go to the insurance company and tell them, I have this group of people, they're willing to pay this amount of money. How much coverage can you provide for them? It's
Hmm.
a negotiation, right? With that
Yeah.
amount of people, you can negotiate better than if I would just go there on my own and say I want to
Oh,
buy something, right? So same thing here. It applies across the world. There's no difference. It's the same thing. We just need to
yeah.
know. And again, I
The
think it's
power is the power number.
the power of number, right? That's
Yeah.
the buyer's power, as they call it.
Yeah. Uh-huh.
So we need to take advantage of those things and use them to our advantage as a community that is struggling to build back itself because we've gone through a lot, and I think things like this will help us, make that change that we all seek and want to bring back home. Because I know we all think, oh yeah, we're here and it's just fine, but people back home need the same level of why not? They do deserve to earn the same level of care that we
Hmm.
can get here. We can bring it back home if we just make sure it's funded properly and structured. It's
Yeah.
really structuring. That's all what it is. If you structure it well, everybody should be taken care of. We don't have to sit back here and be looking for charities to come and pay for people to go take care of
Exactly.
themselves, because they spend the money anyway. Like I always say, right? If you get sick, you will still go and pay that money. So why
Right.
don't you pay it now and know you don't have to worry about it when the time comes?
Comes.
That's how I look at
Right.
it. Mhm.
So, Foka, I want to thank you. I want to thank you so much for
No
sharing
problem.
this thought process with us. I hope our community are listening. I mean, we'll find time again, even after the enrollment period, come out and maybe begin to educate the public on some of
Yes,
this.
I wouldn't
Yeah,
mind
yeah,
having that open conversation with different. I hate to have it only by myself, but all the other
yeah,
people from Lebialam who have ideas like this, who have ideas to share. Let's gather. Let's brainstorm. Let's build a framework of how we can
yeah.
come up with the best things we've learned from this society that we all really
That we can
benefit
adopt.
from
That we can
and
really
adopt the
adopt.
platform
Yeah.
very effectively because we have the
Mhm.
opportunity in the context of we have come through. They say you cannot fall where you're already on the ground, right? The only thing that can happen is you either get up or you stay on the ground. So it's
Yeah.
about how we start to get up. Yeah, I was following on the conversation with your previous program, which was kind of eye opener for me because that's something we, as Georgia, we were trying to find a project to sponsor, and we chose education, bringing
Yeah.
back education in the area Lepang in
Yeah.
yeah,
Yeah.
we want to bring education, focus on education and how we can subsidize and make sure that some level of elementary education, for example, picks up back. Because I know the other parts of them, most of the people moved away already, but
Yeah.
those who still live back there, their children and all those, they have to be educated. So we have to find a way to support and make sure that they get basic education. Even if it means we do it through technology, there's a lot of technology out there that can still get the children educated without a teacher. It's a
Yeah.
mistake at times we make. We only think it has to be a teacher that will teach them, then they will learn. No, there are
No.
tablets right now. There's satellite internet. So no
Like
matter how remote your village is, we can still make sure that your child has a learning program that they follow,
program that they can follow.
and
That
they will
somebody
learn
can make.
better actually because the program really is designed to train them like that. So
Yeah.
those are the kind of conversations I like to have with everyone, anyone who's out there. We want to get our communities built back better, right? Build them back better than they were, and use technology to our advantage. We really need to.
Exactly. Exactly. Especially, I mean, make use of the technology that we have right now
There is so much
to
technology now. We
impact.
just
Yeah, to impact our community positively.
yeah, we're
No.
just not using them effectively, or at least the way we should, because we're a remote community. So those are things we should tap into a lot and take it
Yeah.
to the next level. Bring
No.
that
Sure.
generation that is ahead, coming ahead, to at least have a hope that their life is, you know,
Yeah.
gonna change somehow.
Okay.
We hope.
Yeah.
Thank you again. I really want to thank you for finally making up
No.
time. I know you've been busy since we met at the convention. I
I
kept
know it's kind of
saying,
like no. It's
sorry,
been kind of
time.
yeah.
I'm just
Timing
glad we
trying
did
to
it
look for
on
time.
time. We
Yeah.
did it on the
Yeah.
right time.
It's
Right?
very very difficult.
The timing
Yeah.
is right because I'm really excited that we did it
No.
right
I
in
usually have
that
yeah. We have this program every morning. If we skip means this technology fail us or we do not have unless we are very constrained or
hmm
anybody book an appointment with us Saturday
hmm
morning and Sunday morning. We want those days to be really fixed so
Okay.
that people expect that okay on that day if I just turn on my camera, my computer or my TV or my cell phone, I will get something from Casa Media.
I really appreciate the effort you're putting in there, and I encourage everyone to support this move because,
Yeah,
again, you guys are doing a wonderful job to inform the people about the community. I love
we'll try a little bit.
I
So
really love those reports you guys put together back home because there's no other way
yeah.
we can know, right?
No, yeah, exactly. We won't even know what is happening in
How
our
to
own place.
allocate resources is so important. That's a mistake we're making here. We raise a
Yeah,
lot of money. We don't know how to put it to use,
put it
best
to
use.
use.
But you guys bring out that real local information that helps us
Yeah.
to see where we
Yeah,
can.
so that I think it should help people so that oh, okay, I look at this school. This was what some of the teachers were complaining. Okay, they lack this. Can we
Mhm.
step in there and do something? Okay, what about this school? They lack one of this. Maybe can we step in there?
The last report I saw you guys did was on. I think there was a school in somewhere in Azi where there were toilet issues. That, for example, was something that piqued my attention right away. Like,
That was in Menji.
yes, yes,
Yes,
that
yes,
was
it's
something.
very issue.
That's a local information that who would have thought? I had no idea that a challenge like that exists. Now I have that in mind. I know where I'm gonna go back to my community and they say they have allocated,
Yeah, and say, hey,
they have
if there's some
resources. They're
funding that
worried
we want to
about
do,
where to put it. I can tell them for sure. Yeah, there is where we should put it right now, because
yeah,
that's a need that that community really needs. And
we really need.
hygiene is, if you don't have a good hygiene, you're gonna be dying
Yeah,
from
you are, yeah, that's true.
the schooling
Yeah,
system is not going to work. Everything's going to crumble anyway. So for me, I think
yeah.
I really appreciate that because you guys bring out this local knowledge that we really
No, no, thank you
nobody
so much. And we do
nobody
appreciate.
we will do everything to keep you guys rolling as much as we can. Again,
No,
you come across so many different people from different perspectives. So if you do have an opportunity to bring those ideas together and have us on a conversation platform like this,
yeah,
you'll be surprised
we
what will happen in the next couple of years. So
Yeah, exactly.
we have that open conversation. We have ideas bouncing off each other. You would be surprised exactly what will come out of
Yeah,
those.
and I think you touched one of the point too, especially like different people, even people listening to you right now, like you mentioned, like there are people that they might be in the same field
Mhm.
or a
Doesn't
little
have
bit
to be. There are so many other
without.
things that
Yeah, so
you
that they
can,
can come to us and say,
you
hey,
can merge
we're doing
ideas.
it to yeah, mesh idea. Let's do this. Let's take it to a whole different level. Let's do it
Right.
bigger. Then I think,
Every it's like a puzzle, right?
yeah,
Everybody's feels their piece on that puzzle. So
yeah,
that's
then,
how I want us to look at it. As a community, it shouldn't be me or my way or the highway, right? It should be all the
mhm,
effort of everybody who's best at what they do. We all put that together and we feel that puzzle and you see it come together nicely. I think that's really where we will be, wherever we want to be. When we
yeah,
say Lebialem 2050, I think that's where the conversation should be going.
potential is going. So,
Yeah.
what are the small things that we'll be doing gradually to get it to that point?
I really
Really,
would. Don't hesitate. Reach out any day, anytime. I will be happy to join a conversation like that.
no, sure.
My capacity and the ways I can contribute, I would be
No,
happy.
sure. I know as time goes on, we'll begin to have some kind of community policy,
Correct. Like
small,
shaping
small
policy,
initiative,
right?
yes,
Ideas.
that can really shape ideas, that
Mm.
can really shape mindset. You
Yeah,
know,
like the insurance one I just told you, for example. I know a lot of people would never have thought of it that way. They'll probably think, oh, we should go and be asking for funding.
yeah,
How long would you be begging people to come and help you take care of something you already do? But you're only just doing it from your own personal level and then not taking advantage of the group
advantage of it.
of like bargaining as a group. It's
Hmm.
a powerful thing, right? Come to think of it. It's just the fact that you guys gathered together and bargain that gives you that
Yeah,
power. Not because you did anything different. It's just because we go, if we say, okay, everybody contributes 1,000, all right? And then we have maybe 100 million people. That's a lot of money.
none.
I say, okay, I go to the insurance company and I say, I want to buy insurance for 1,000. They're not interested. You see what I mean?
Mhm.
It's a non-starter for them.
Yeah,
But if I say, oh, okay, I want to buy insurance, I have $10,000. Ooh, that's a
oh,
starter. They'll believe. They'll
yeah.
they'll
Wait,
they'll,
wait, wait,
they'll,
wait.
they'll get
No,
over.
wait, hold on, come on, let's stop. I
Let's
know,
talk.
right? Yeah.
You see how it works, right? It's really simple. That's really the game of numbers. It's called a
Mm-hmm.
pooling your resources.
Fully, yeah.
And I think we can apply it across the board. It doesn't matter what industry you're in. When you negotiate with a group of people and do things in a pooling resources together, it's always going to benefit the community.
Yeah.
I think that's the way forward. In
Forward.
anything we do, we can look at it from any angle, from investing in developing our community. We should get out of that mindset of always thinking we have to donate, contribute. No, we should look at it from that aspect of how do we pull resources and develop,
And
pull
develop
resources
it
and develop. There, it's really
for a
important.
system that can self-sustain itself.
Right.
I think so.
That's
Yeah.
exactly the idea, right? If you pull the
Yeah.
resources together, you have a stronger bargaining power. You make more change.
Hmm.
You
Yeah.
effect more change, rather, is the way I
Change.
put
Yeah.
it. You
That's
effect
true.
change. So yeah, any day, anytime. Thank you so much. I think we're already going way beyond the time that you're putting in.
Yeah. Thank you. Yeah. Okay. Yeah. Okay. Dear viewer. Yeah. Bye. Okay. Dear viewer, want to thank you so much for taking the time to listen to us. Mr. Ken has explained a lot of information. So please, if you do have anything that you need, that you can reach out to him. The number is there. He can walk you through, especially if you are in this kind of category that are defined low income and you have a little bit larger family where you cannot really afford insurance or where you don't have insurance from your work or you don't know when a child may fall sick or where you yourself you can fall sick after that, please take arrangement, uh, the opportunity, especially this enrollment period that will end on the 15th of December. You barely have 3 weeks to go. So get on board. If you are a little bit internet savage, get on the internet, look for the website, enroll. If you cannot, contact him and he will walk you through. I want to thank him so much. And thank you too for listening to us again. Until then, we'll see you next time and have a wonderful weekend.